All right. Uh, Let me just get back there. Hello, everybody. On behalf of the Augusta Memorial Public Library, thank you for joining us for today's virtual workshop. For more information about this program or others, please visit 113 North Stone Street, Augusta, Wisconsin. That's the location of the library, or you can visit them online at augustalibrary.org. Today's program is titled A Toolkit for Caregivers: How Health Literacy Can Help You and the People You Care for with Dementia. It was supported by a grant from the Retirement Research Foundation for Aging. My name is Cassie McLean, and I am the Regional Community Coordinator for the North Central region of Wisconsin Health Literacy. And the first thing I want to say is thank you. Thank you for the work you do. And I know you do it out of love, but without you, so many people who have dementia in our state would not be cared for. You are one of many people who are providing truly remarkable care. So today's program was developed by Wisconsin Health Literacy, which is a statewide nonprofit organization offering education and training on health literacy. They offer a variety of different community projects throughout the state. They also provide a health literacy summit, which they do every other year, and the next one will be in April. And they are a division of Wisconsin Literacy, which is has over 70 members throughout the state. So today we're going to talk about health literacy. I've already used that term several times, but what does it actually mean? And how does it impact your ability to improve communications with those that you care for and with the healthcare providers that are providing services for them? And we'll also review a little bit some of the resources that are out there. So our goal is to really improve the caregiving for people who have dementia. And we do that by providing help to you folks, to the folks that are providing that care, so that you can communicate better with health providers, with people that you care for with dementia, and also other family members, because we do know that when you're caring for someone with dementia, it's a whole family that's involved in trying to make sure the communication is going well. This is a quote from one of the folks that helped us put this presentation together. And as we were working on it, she made the comment, you know, Alzheimer's, it shows no gratitude, sympathy, or empathy. So as the caregiver, you have to show all three. And it's difficult and it's hard, but it is part of your role as a caregiver. So let's just start very briefly. What is dementia? Well, dementia is a brain disease. It's not a normal part of aging. Some of the early symptoms of dementia may be confused with some of the normal part of aging, but as it progresses, you start to realize that there are things that are going on that are not a normal part of aging. Alzheimer's disease is the most common type of dementia. So think of the term dementia as kind of an umbrella term. There are different types of dementia that fall under that, with Alzheimer's disease being the most common type. So if that's dementia, what is health literacy? Well, there really are two sides to health literacy. The first side, a person's ability to access, understand, and use their health information. The second side of it is a provider or a caregiver's ability to communicate health information in a way that the person can understand. So it's a two-way street. You have to be able to access, understand, and use that information, but it's also important that the person sharing that information is doing it in a way that you can understand. So if someone has low health literacy, what does that mean? Well, people with low health literacy may have difficulty finding health services. They may not understand spoken and written communication. I'm sure you know when we go to a health provider, we are given so much information. And a lot of times a provider may think, hey, I gave them all of this written stuff. I've done my part. But if you have low health literacy, you may have difficulty understanding that. You also may have difficulty sharing information with doctors, with other family members or caregivers, and that can be a problem. You might have difficulty filling out forms, managing chronic health conditions, difficulty taking medicine correctly, or reading medicine labels, or using your health insurance. And a lot of times, if someone has low health literacy, they feel a little guilty if they have to ask a question or if they have to ask for something to be repeated. That's not the problem of the person with low health literacy. That's the problem of the person presenting the information. So a person with low health literacy may be the person with dementia, or it may be the caregiver. You may be responsible for making sure your loved one is getting the health care they need. But if you're having difficulty understanding the information given, that can really be a difficult problem. So what's it like if you have low health literacy? I want you just to take a moment and read this. And I'll stop you right there, because what did that feel like? You probably looked at it and you thought, what is this? What am I seeing here? If you have low health literacy, or have difficulty reading, or have difficulty comprehending, the way you felt when you first looked at this is how that person with low health literacy can feel. I'll just read this for you. It's basically just written backwards. Your physician has recommended that you have a colonoscopy. Colonoscopy is a test for colon cancer. It involves inserting a flexible viewing scope into your rectum. You must drink a special liquid the night before the examination to clean out your colon. And I would say that even if this wasn't written backwards, that information can be very difficult to understand. There are a lot of big words in there. There are several concepts or directions within that. And even if this was written frontwards to backwards, it would be difficult to understand. So one of the things that we know is there are different predictors of an individual's health status. And of everything I have listed on this page, which one do you think is the single strongest predictor of an individual's health status? Age, income, literacy skills, employment status, education level, their racial or ethnic group. I can tell you that all of them do impact an individual's health status, but the one that is the single biggest predictor is literacy skills. 20% of American adults read at or below the 5th grade level. A newspaper is generally written at a 6th grade level. Most healthcare materials are written above the 10th grade level. That little instruction that I gave you about the information for a colonoscopy, that is written at a 10th grade level. And that is the type of information that people are handed. So we have to really look at what can we do to make this a little better. So who's at risk for low health literacy? Well, unfortunately, almost 60% of seniors have basic or below basic health literacy. Now, this doesn't necessarily mean literacy skills are that low, but health literacy. Remember some of the things we talked about, being able to understand the information that you're given. There are so many pieces of information that we're given that it can be very difficult. So why is it older adults? Well, first of all, older adults have decreased reading skills. We may have more issues. We start to have more issues with our hearing and our vision. We suffer from more depression and anxiety. Short-term memory loss, that can be a normal part of being an older adult, but it also can have an impact on your ability to understand the information you're looking at. We also have more chronic illnesses. So we use more medical services. So the chance of having confusion about what we're trying to do is just greater. And there's also a risk for, more of a risk for medication mistakes because you take more medication. So that just adds to some of the issues. So that's why older adults are really more at risk for having low health literacy. So how does improved health literacy help you as a caregiver? Well, if we can improve your health literacy, you can take better care of the people you love. You can feel more confident and satisfied in the care that you're providing. You can communicate better with health professionals and those other family members that may have lots of questions, but may not be directly a part of the day-to-day care of your loved one. And by supporting people with dementia, they can stay in their current living situation longer. So if we can help you do your job better as a caregiver, that helps the person with dementia. So I want to talk just a little bit about medications and health literacy. I mentioned that as we get older, we tend to be on more medications, and that can be a bit of a problem. So this is something that actually happened. This was something that was reported to us. My grandma accidentally took 3 times the daily dose of a medication for about 4 days due to a label that stated, take 1/2 pill twice daily. Now, she was just supposed to take a 1/2 pill 2 times a day, but that one on the label before the 1/2 made it look like she was supposed to take 1.5 pills twice a day. And I can tell you, the first time I saw this, I thought, well, no, she took the right amount of pills. This is just an example of how labels can be very confusing, particularly with medications. And we are working very hard with different pharmacies around the state, Wisconsin Health Literacy is, to try to make labels make more sense. So one thing that you can do to increase medication safety is schedule a meeting with the pharmacist or the health provider to review all of your medicines. I'm sure you know, anytime you go to the pharmacy and you pick up a prescription, they usually a tech person will help pull everything together. They'll take your money, they'll hand you your bag, and they'll say, do you have any questions for the pharmacist? It's okay to say, yes, I have questions. You can always ask the pharmacist to review the instructions on that medication. You can always ask them all of your questions. that's why they do that, because they want to make sure if there are questions, and it doesn't have to just be with a new medication. If you're not quite sure that you're giving the medication at the right time of day or the right number of pills, that's what the pharmacist is there for. You can also always go over it with your doctor. If you have an appointment with a doctor, they always say, bring in all of your medications in their original containers. Do that. Make sure that if they haven't asked to look at them, that you remind them. You said I should bring these in. Look at all this. Because there are ways that they need to double check that there's nothing that's working against each other with your medications. Pretty basic, use a pill box to remember when to take medicine. And I think we're all pretty familiar with the, pretty simple one that has the 7 days on it, but you can get them now with 2 days. So it's one pill box, but it's got a morning and a night. You can get them with 3 slots. You can even get them with 4 slots. So there are ways that you can do this to really help manage your medications. Always keep a list of current medicines. Once again, when you go to the doctor, they review those with you. Well, if you have your list of current medicines, you compare that with what the doctor is going over with you. One thing that has come up sometimes is that the person you're caring for may start to have some difficulty swallowing a pill. Ask about other forms of medicine if the person you care for can't swallow a pill. They can, and it depends on the medicine, but some can be made to be chewable. Some can be made to that they dissolve in your mouth. You don't have to swallow it. Some can be made into a liquid that you swallow. Easier to swallow a liquid than a pill. But you can, not every medication can come in different forms, but you can always ask if your loved one is starting to have difficulty with that. Be careful. Sometimes pharmacies use different pill manufacturers, so colors, sizes, and shapes can be different from one refill to the next. Generally, the pharmacist will tell you if they're using a different pill manufacturer and the pill looks different, but pay attention to the color of the pill, the size, and the shapes. And you can always ask if you have a question, because you don't want to have the wrong medication and think it's the one that you were using. Every new medication, and this means whether it's prescription, over the counter, or even vitamins, ask the pharmacist about side effects and reactions with other medicine. Now, you may think, well, I'm picking these vitamins up in the aisle. Should I go up to the pharmacy and ask them if this will interact with any of the prescription medicines I'm taking? Yes, you can do that. Take them up there and ask. That's part of their job, to make sure that everything is going well with any medications that you're taking. It's always best to ask a pharmacist, but the AARP does have a great resource. It's a drug directory, side effects, and interaction checker. And you can just go on the AARP website and you can find that information. But that's a last resort. Always ask your pharmacist or your doctor. So talking with a health provider, this is an area that can be confusing, can be a little intimidating, but there are things that you can do to make sure you're getting the information that you need. First of all, always prepare for appointments. Write a list of questions and things that you want to talk about in that appointment. A lot of times, the provider has kind of a list of things that they're going to go through, And that's great, but make sure you do not leave until your questions have been answered. And you can help the doctor prepare for that. A lot of our health systems now have like an online portal where you can send questions. I actually have a doctor's appointment coming up this week, and I sent my question to them. I opened up the messages link and I said, I'm going to ask about this. And so then the doctor is prepared. They know some of the questions that you're going to have. So don't worry about doing that. You can also, if they don't have the online portal, you can call the doctor's office and talk to the nurse and tell them these are the questions I'm going to ask when I come in for my appointment or for my loved one's appointment. Before you leave the doctor, review what you talked about with the doctor. Doctors and other healthcare providers are taught to use something called teach back. It's a way to check understanding. It's not meant to quiz a person. Instead, teach back helps you know if the provider did a good job explaining. So it's okay to say to that doctor, if they haven't asked you, you can say, okay, we covered a lot of information today, so I'm just going to tell you what I heard. These are the things that you suggested. So you can get the information. If the doctor says, whoa, wait a minute, that I think I maybe have to talk about this a little bit, that's okay. If it shows a misunderstanding, it can be re-explained in a different way, and then you do the teach back again. So it's between you and that doctor or that provider, making sure that the information that you were given is the information that you're understanding. Talking with your loved one. This can be challenging, particularly as dementia progresses. So what can you do? Probably the basic thing is be clear and direct. I put this in here, introduce yourself and explain what you are doing. If you are with your loved one 24 hours a day, you may not always need to introduce yourself, but if it's a time of day when your loved one is having, has more difficulty with, it's okay to say, hi, Mom, it's me, Cassie. I just came in. It's time to brush our teeth before getting ready for bed. It's okay to introduce yourself, to say that. When I was helping my mom, there were times when I could tell just how she looked at me that she was working very hard to remember who I was. Sometimes she thought I was her sister. Sometimes she thought I was her mother. If I helped her with that by just telling her who I was, it solved a lot of problems. Make sure when you are working with your loved one that you talk directly to them, to the person you're caring for. Make eye contact with them. And this last one is something that I think is very important, particularly if you're at a doctor's appointment or just another appointment with your loved one. Don't talk with other people in the room about the person with dementia. Make sure that healthcare provider is talking to the person with dementia. You may be able to help answer the question, but the conversation should be between the provider and your loved one. It's a respect thing, and they know when they're being talked about. Always try to create a welcoming environment. Be respectful and sensitive, be patient. Isn't it easy how, I could just put those two words, be patient, as though it's a simple thing to do, yet I know it is probably the most difficult thing that you can do. Avoid saying, don't you remember? We just talked about that. That's kind of the basic problem with dementia. They don't remember, even if you just talked about it. Remember, it's short-term memory that is really impacted. So those last two, be patient and avoid saying, don't you remember, can be so difficult, and so you can feel so frustrated. When you are feeling frustrated, try to remember it's the disease, not the person. For example, it's not that mom was bad today. The dementia was bad today. Your mom still loves you and cares for you and wants to be a person you can love back. The dementia is the issue. What else can you do? Well, use plain, simple language, words with 1 or 2 syllables, simple sentences, 1 idea per sentence. Don't use jargon or acronyms. Give very specific instructions. If it's time to brush their teeth, take the toothbrush, toothpaste on, toothbrush in mouth, and very simple, very specific instructions. If you say something like, okay, it's time to brush, let's get that toothbrush. Where's that toothpaste? Which kind do you want to use today? Okay, let's get it on there and let's brush. It becomes very confusing. They don't remember the first thing you said. They may remember the last thing you said, and it just gets all jumbled up. So remember, it's just words with 1 or 2 syllables, simple sentences, 1 idea per sentence. Name the object instead of saying it or that. Go pick that up off the couch over there. They have no clue what you're saying. The book is on the couch. You can go get the book, and that helps them. It's all about helping them with where they are at. Using the active voice, not a passive voice. Turn questions into answers by saying the solution, not the question. Where do you want to go today? Instead, how about, let's go to the park. Let's go to the living room. It's active and it's the solution. It's not a question. Negatives into positives. As much as you can. This one, as the dementia progresses, it's just, you have to do the math. You may have to do it for family members and also for the people with dementia. Just be very careful with numbers. They're not going to understand percentages. They're not going to understand even, a pie chart. It's very difficult. So just be very careful with numbers when you're asking or discussing something with them. Slow down, speak clearly and slowly, pause at the end of sentences and before changing topics. If you have someone in the family who also helps with your loved one, this is something that you really want to focus on with them, how they can communicate with your loved one. Speak slowly, clearly, and pause at the end of sentences and before changing topics. These couple of things can help so much in communicating. Reinforce words with just make sure you're using pictures that clearly explain your message. For instance, which one is better to use when talking about eating healthy foods? Obviously, the one with the folks eating is probably the best choice. The other couple, they may be on their way to the store to buy groceries, but it's not really a message about eating healthy foods. Don't give too much information. Remember what I said about, 1 idea per sentence. 2 to 3 need to know pieces of information at a time. Don't overwhelm with details. That can actually cause anxiety. As I said earlier, you start to give them this whole long explanation, and they lose it. They lose track of where you're going with this and what they're supposed to do. Use words and comparisons that are meaningful to the person you care for. If they call movies flicks, I mean, I never did, but if my mom called a movie a flick, you can call a movie a flick if it's a term that means something to her. Encourage questions. And this is probably more to do with other family members, because they may have a lot of questions. Your loved one, as the disease progresses, they're not going to have a lot of questions. They may ask why over and over and over. So encouraging them to, your loved one to ask questions may not be the best way to do this, but other family members may have questions, and talk with them in a way that encourages questions. I know that as the caregiver, you can be just very exhausted by the whole thing, but if you can get other family members to ask their questions, that can help you explain things to them. How can you help the people you care with memory? Well, early on, using written instructions to support the instructions that you've talked about, that can be helpful, but be very careful that you're not overwhelming with written instructions all over the place. 12 written instructions on the refrigerator, you don't see any of them. So you want to be very careful with that. But in the early stages of dementia, it can be very helpful to have some key things written down that they can refer to. Learn what part of the day works best for the person you care for. In general, mornings are usually better for a person with dementia. That's when you can do newer things or do more active things with them. But that's not true for everybody. Some people, if they've been a night owl all their life, evenings and night may be more of an active time for them, and a time when they can process information better. So just keep that in mind. And then this is also something that in one sentence just doesn't do it justice. Find strategies to help when the person you care for becomes frustrated or upset. Sometimes that can be just, letting them go through it. Sometimes it can be you becoming very quiet and not asking them to do something. Sometimes it can just be showing them if they're getting very frustrated and they don't want to put their jacket on. If you just put your jacket on and be very quiet and calm, that can help. But those are obviously the very difficult times. And also make sure you have a plan for when you get frustrated and upset, because that is really something that they are going to feed off of. There are some health literacy considerations if you happen to be working with refugee or immigrant populations. There are some cultural considerations. Beliefs about medicine and healing practices may be different. Caregiving roles through the end of life may be different. There may be past trauma experiences, or they may not be familiar with the healthcare system. And I wasn't sure about including this in this presentation, but one of my coworkers works with a family member who was actually from another country. And so it is important to be aware that there are different cultural considerations when you're working with someone from another country. A few other things. Sometimes the word Alzheimer's can be difficult for a person to hear. Sometimes it's just easier to say memory problems. Oh, you know how your memory's not working. And I know for my mom, that was something that was easy to do. She knew she had issues remembering things. And so we could just say, oh, we could almost make a joke out of it. Oh, your memory problems. And just be aware that you don't have to use that word Alzheimer's or even the word dementia, because it can be difficult. People with dementia can have behaviors or say comments that hurt the people who care for them. It's going to happen. That's why, as I said earlier, you need to make sure you have a plan for how you're going to take care of yourself. Always remember, facial expressions, tone of voice, body language, they are all important forms of communication. Your loved one may get to a point where they don't understand the words or can't comprehend the words. But remember, people with Alzheimer's or other dementia, they may not always remember what you said, but they will remember how you made them feel. Emotions are often the last to be forgotten, if at all. Also, give yourself a little bit of a break. You are not alone. More than 6 million Americans have Alzheimer's disease. Over 11 million Americans provide unpaid care for people with Alzheimer's and other dementia. It's important to take care of yourself, and even more so when you are helping take care of another person. Stress, burnout, fears, and tears are real. There are places you can go. Family caregiver support through GWAR has a lot of great ideas. For local resources, every county has an aging and disability resource center, and they have caregiver support groups. Call them, find your local one, talk to them, get the support you need. The Alzheimer's Association has a wealth of information that can help you. Just remember, it's about helping take care of your loved one, but it's also about taking care of you, because you can't take care of your loved one unless you're also taking care of yourself. And so again, I just want to say thank you. Thank you so much for everything that you do in taking care of your loved one. If you have any questions, please feel free to send me an email. I have a pretty simple email, Cassie@wisconsinliteracy.org. I also want to let you know that at the Augusta Public Library, they have copies of a workbook that we have put together that has this information in it. So you can contact them at the library. And just as a reminder, they're located at 113 North Stone Street in Augusta, or their website is augustalibrary.org. So thank you again, and thank you for sitting in and listening to this presentation.